All right, so we're going to move on to our assessment of youth substance use exercise. And just to kind of re-ground us, the most common fit factors sustaining substance use are essentially the same ones that support any other antisocial behavior that we've talked about so far this week. So when you think about drivers of low supervision and monitoring and negative peers, we've seen those come up on a lot of other fit circles for some of the other antisocial behaviors that we've talked about. Those are also the same ones that support substance use in adolescence. Essential to MST conceptualization is the fact that it takes a combination of these factors to create a substance abuse problem in an adolescence. So again, we want to look at the combination of factors, not just one factor. So in this exercise, we're going to put some assessment pieces together to understand what drives Kim's substance use. So you guys remember Kim, we've talked about her earlier in the week a few times. So we're going to utilize her case to talk about and assess the adolescent substance use. So just to remind you guys, thinking back to Kim's referral behaviors, she was brought into MST because of marijuana use and an arrest for possession. And one of her overarching goals is that she was going to achieve cessation of her use. So what we know about Kim's frequency, intensity, and duration is she's using about 4 to 6 times a week, typically 2 to 3 joints at a time, and this started about 6 to 9 months ago. So if you guys want to look at your handout, we spoke about the handout, this handout a little bit earlier in the module, the worksheet for assessing youth substance use. It's handout 3A. So what you guys have here is a partially completed assessment that you did at a previous session with Kim and her family. You guys note that the fit circles in this handout are blank. We're actually going to be working on that together as part of the exercise. So what you also see is that there's a sequence that captures Kim's recent use. So what you guys did, because you're such great MST therapists, is you left Kim and her mom this as a homework assignment to do. And this, of course, is increasing their responsibility and showing continuous effort by giving them homework as well as targeting sequences. So you're really using all the principles to gather that information. So just take a look at it. Again, you have a lot of information here about when Kim started using, what she uses, who she uses with, where she's likely to use, where she's not likely to use. And so what we're going to do is I'm going to divide you guys up into some small groups, and you are going to take this partially completed worksheet for assessing substance use, as well as the sequence of events that you guys have here. And you are going to generate a fit circle on Kim's marijuana use. And what you guys can do is on page 3B of your handout, you could just use this blank fit circle to fill in your fit. Now, you don't have to limit it to just the, 6 drivers, 5 or 6 drivers. You could have more if you need to have more, so don't get stuck on just the fact that there's only 6 arrows there. You can even have less. So, does anybody have any questions so far? All right, so as you guys, again, go through the exercise, use the sequence, use the information that you have from the worksheet for assessing substance use, you'll create your fit. Then we're going to come back to the large group. We'll talk about all the drivers that you guys came up with. All right, any questions before I break you guys up into groups? Okay, great. All right, so, let's talk about the fit. Let's talk about the drivers that you guys came up with for Kim's marijuana use. Who would like to go first? All right, so you guys came up with some really great drivers, and what I'm going to do now is I'm going to show you guys the next slide, which is the fit of Kim's substance use that we have generated. And typically, again, as you see, these are the most common drivers that we have and that we see for marijuana use in adolescents. You may also see other drivers based on your individual assessment within each family. Any questions?